Namaste. Welcome to Indian Knowledge Systems Primer Course for Children. In this session, we will be looking at Roga. In Ayurveda, health is seen as balanced doshic manifestation. We have already seen there are three doshas, Vata, Pitta and Kapha. These are energy complexes that govern the bodily functions. When these doshas individually or as a combination go out of balance, that leads to disease manifestation. Such manifestations are called as Roga. Hence, bringing these imbalanced doshas back to balance is the recovery process from Roga. A healthy body is considered as one where the doshas are in perfect balance. Let us now try to understand the different types of diseases or Roga, their causes and treatments as mentioned in Ayurveda. In Ayurveda, Roga is broadly classified into two types. One is Nija Roga, where the doshic imbalance is because of internal factors. For example, one develops a gastritis condition when they have consumed a lot of hot and spicy substances. The second classification is that of Aghantu Roga, where the causation for the disease is that of external. For example, external injuries caused by accidents and the like. The treatment strategies for these type of Roga are varied. One is where we try to restore the doshic balance. Another is we provide for prescriptive diet and lifestyle changes. There are also herbal remedies that are available as a treatment plan. The fourth is that of well-structured designed therapies such as massages, yoga, etc. Now, let's try to understand how diagnosis happens. I am sure a lot of us would have visited hospitals and clinics earlier. So, when we pay a clinic visit, what usually happens there is the doctor over there asks us a few questions, and then what happens? He wears something around his neck, the stethoscope. He tries to sort of understand how the heart beats. And then he probably asks some more questions that may span across what we have eaten, when did we have this discomfort, and so on. He then picks up his notepad and writes a prescription. He probably also goes on to explaining these are all the medicines that would best suit you. He would then go on to explain what is the dietary regime that would help us to recuperate from the disease. Sometimes we might even get an injection or two. So this is the usual process that happens in the allopathic system. So how does diagnosis as a process work in Ayurveda? Diagnosis, I am sure all of you understand, is where the Vaidya tries to understand what sort of disease you have developed. Let us now try to understand the Ayurvedic examination methods. A Vaidya usually tries to do three things during his examination. One is Sparshana, another is Darshana, and third is Prashna. Darshana is when he carefully observes and inspects the patient. It could be the color of the tongue, it could be the color of the hair, the color of the eyes, the luster in the skin, and so on. Body language, skin color, eyes, tongues and nails are all inspected very carefully. This helps to determine the dosha imbalance. For example, if there is too much discoloration or lusterless hair, there is a fair chance that the pitta is imbalanced. Sparshana. Sparshana is examination through touch. Sometimes you could see a Vaidya holding on to your wrist this way. He tries to catch the pulse. He tries to understand how it is. He also analyzes the body temperature. He might touch your joints to feel the temperature. He would touch and understand your skin texture, the moisture level in the skin. All these helps to identify the doshic constitution. Prashna is where he actively questions the patient. He asks about what was he eating, what was he doing, what is the exact discomfort he went through. This can also involve questions related to medical history, lifestyle, diet, current symptoms, and so on. Prashna usually helps in determining the root cause of the disease. So, after the overall examination, the goal is to develop a personalized treatment plan wherein the focus will be to restore the dosha balance and promote optimal health. Now we have seen how a Vaidya examines a patient. Let's try to understand how will he diagnose the disease. So there are 5 critical aspects that he will look for while trying to diagnose. Number 1 is Nidhana, where he understands the cause and the etiology. This will include lifestyle, diet, environment and genetics. Second is Pragrupa or Purvarupa. This is otherwise defined in English as prodromal symptoms, wherein starting from the onset of a preliminary symptom to a full-blown disease symptom, what has been the time taken, how has the disease progressed, that's called Pragrupa. These will include early warning signs and early diagnosis. Third is Lakshana. Lakshana are signs and symptoms. These are also clinical features. They try to see the color of your eyes, the color of your tongue. How do you walk? How do you sit? How comfortable are you? All of these are Lakshana. So body constitution, pulse, tongue and skin are all examined in Lakshana. Fourth is Upashaya, wherein it involves a lot of diagnostic tests, lab tests, imaging, specialized tests are all involved in Upashaya. These are helping instruments to arrive at an appropriate diagnosis. Fifth is Apti and Samprapti, which generally is called in English as pathogenesis and progression. The Vaidya tries to understand what has been the growth curve of the disease. How did it start? How did it progress? At what stage is it in? That's called as pathogenesis. So it will involve understanding the dosha imbalances that has been caused, what were all the disrupting factors, when there was too much imbalance, how did the disease spread, all of this is included in Apti and Samprapti. So we have seen what happens when you meet a Vaidya. First, the examination, and then they try to arrive at the diagnosis. So what happens after is the treatment. There are 2 major categories of treatment. One is Shamana, another is Shodhana. In Shamana, it's more to do with identifying the symptoms and trying to treat the symptoms alone. It alleviates the symptomatical disorder alone. It doesn't address the root cause. So it's a palliative treatment and it is usually done during the initial stages of the treatment. For example, the focus will be on balancing the dosha alone. Some examples include applying oil when there is a vata imbalance, consuming ghee and similar preparations when there is a pitta imbalance. Similarly, if there is a kapha imbalance, you will be advised to have a bit of honey. In Shodhana sort of treatments, it involves a lot of purificatory processes, and this is usually prescribed for advanced stages of the diseases. Whenever Shodhana samskaras are prescribed, that means the disease has started to progress in one part and it has started spreading all over the body through the shrotas, through different channels. So, it will involve removing the imbalanced doshas, at the same time focus largely on eliminating the root cause as well. For example, in advanced stages of diseases, when there is a vata imbalance, basti will be prescribed, wherein your whole colon, large intestine and all of that will be cleansed completely. It's a purificatory samskara. At the same time, if it is a pitta imbalanced, an advanced stage of pitta imbalance, it will lead to virechana or purgation, wherein we will try to remove the excess pitta from the impacted area. Third, for example, if there is a high kapha imbalance in the advanced stage, we would perform vamana. Vamana is induced vomiting, which will remove the excess kapha out of the body. The choice of the treatment largely depends on the type and the severity of the disease. Also, a very critical aspect that governs the choice of treatment is the individual needs of the patient, because sometimes some patients will have physiological complexities where Vamana might be tough. For example, if people have asthma condition, then Vamana is not prescribed for. Below are some examples for treatment of specific imbalances. We have already seen this is more of a reiteration. When there is a Vata imbalance, Abhyanga can be prescribed. When there is a Pitta imbalance, usually as a palliative care, we give them cooling foods. In an advanced stage, we prescribe them purgation. If there is a Kapha imbalance, as a palliative care, we give heating foods, gargling, spices and herbal smoke inhalation. Let us now try to understand another ancient technique of diagnosis that is available in Ayurveda, called as the Nadi Pariksha. Nadis are roughly translated as energy channels which run all across the body. Typically, an Ayurvedic Vaidya would request you to extend your hand and catch you by the wrist. He'll keep his 3 fingers in 3 different points and try to read your pulse. These pulse reflects the 3 doshas, the Vata, Pitta and the Kapha. If you see, the position of the fingers will also reflect or map to their respective doshas. As mentioned in this illustration, the index finger maps to the Vata dosha, the middle finger maps to the Pitta dosha and the ring finger maps to the Kapha dosha. During pulse diagnosis or Nadi Pariksha, the practitioner tries to understand what is the strength of these pulse, what is the rhythm of this pulse and what is their quality. All of these are examined with utmost care to determine what is the patient's dominant dosha and if at all there are any doshic imbalances. The pulse analysis helps the Vaidya to develop a customized treatment plan for individual patients. Let us now try to get a preliminary understanding of how pulse reading actually works. So, when the Vaidya places the index finger onto your wrist, he tries to understand the Vata pulse. The Vata pulse is usually considered to be irregular, feeble and easily influenced. Imbalances would cause anxiety, stress, insomnia and digestive issues. The middle finger which points to the Pitta pulse is always strong, bounding and forceful, imbalance of which would cause inflammation, high blood pressure and fever. While the ring finger would point to the Kapha pulse. The characteristics of a Kapha pulse is that of slow, steady and heavy, the imbalance of which would cause congestion, obesity and lethargy. We have now seen how an Ayurvedic examination works. How does the treatment plan happen? How does the diagnosis process work? And the different type of diagnosis such as that of Nadi Pariksha. Let's move on to understand what are all the 4 factors that affects the Ayurvedic treatment process, which is otherwise called as Chikitsa Chatushpada. First, in the aspect of the doctor or Bishak, he is expected to be alert. He should be very well disciplined. He should have detailed knowledge and experience in practice. He should be clean. Cleanliness is one of the foremost quality expected out of a Vaidya. Second, when you consider the medicinal aspect, the Dravya has to be of varied dosage forms. It should have multiple qualities. It should be endowed with virtues and it should be disease specific. It should be suitable for that particular disease. The third factor that we talk about now is Dhatri or nurse. The individual who is nursing should be compassionate, should be clean, they should also be alert and they should have intelligence. Now, coming to Rogi or the patient is expected to be obedient to the doctor. They should follow instructions exactly. They should have very good memory because only then will they be able to recollect what or how the symptoms manifested in them. They should have the strength to tolerate the disease and the treatment. They should have that level of endurance. And last, they are expected to have some level of financial stability, not because they have to cope up with the treatment, but because they fell ill, they may not be able to wield their purusharthas, and hence some level of financial security will be useful at this time. So, we are able to clearly see that the Ayurvedic diagnosis and the treatment process is very holistic and it provides for a very personalized approach because it tries to address the root cause and not just the symptoms. It tries to restore the doshic balance to ensure overall health. Hence, it can be very individualized treatment as well. The tailor-made treatments can be in the form of herbal remedies, diets and lifestyle modifications. Some examples include Panchakarma Chikitsa, yoga and other therapies. We can also see that it is very effective and sustainable because every treatment is very customized to the individual's constitution and the imbalances. They can hence ensure long-term health benefits. They are now growing in popularity and scientific validation as well. There is an increased global recognition that is happening to Ayurvedic treatment process. Hence, effectiveness is proven in various research studies as well. By this, we can clearly understand the modality of treatment in Ayurveda, although sometimes would sound new, it is very robust. At the same time, it addresses the need of that particular individual. It is important to understand that health in Ayurveda is seen as a balance of the doshas and any sort of disease manifestation is not externalized. We try to intuitively understand what imbalances has caused the Roga. One can understand Ayurvedic way of treatment is very holistic and robust. Thus, Ayurveda provides for an intuitive process which enables the individual to understand Roga as an imbalance, thereby empowering them to become responsible and take control of their own health. Let us also get ourselves accustomed with such intuitive processes and live a very empowered and happy, healthy life. Thank you.